Good morning, YouTube family and friends. Hope you had a great week. My week it was okay. Nothing too weird happened. Besides, I had my procedure yesterday. I posted a video last night talking about that going under anesthesia with having generalized myasthenia gravis. So you can watch that video if you would like an update on that in regards to the final test to see if I qualify for the Inspire sleep apnea device. So this video is going to be my week 29 results of being back on Mounjaro. Today is Saturday, October 12th, 2024, and yeah, it's kind of a deceptive this week. Back on Mounjaro, because if you watched last week's video, you know I didn't take my Mounjaro shot last Saturday because of going under anesthesia yesterday. They don't allow that up to 7 days before going under anesthesia because Mounjaro slows everything down, empties the stomach slower, so they can't have that if you're going under anesthesia. So they said I couldn't take it last week. So yeah, I didn't have my Mounjaro this week. So we'll see what the numbers show on the scale and on my blood sugar. So I do have an update for you on the myasthenia gravis. You know that my insurance denied the VivGuard infusion treatment plan. They said I needed to try the other drugs, cheaper stuff first. So kind of like they want me on a steroid first. I've talked about this before in my videos about how because of my diabetes and my non-alcoholic fatty liver disease, which just turned to liver cirrhosis, they didn't want to do the steroid treatment plan on me. That's why they wanted to do the VivGuard infusion first as my treatment plan. But the insurance denied it. The doctor appealed. The insurance denied the appeal. So, but the neurologist did state that he was going to do a review with the kind of like upper management of the clinic. And I heard back from the neurologist office this week. They approved the upper, higher up, the management, whatever you want to call them, approved the doctor to take my case up to the state. I didn't know they could do that. I didn't know that the state had any influence on what the insurance companies can and can't cover. But yeah, I don't know what all that's going to entail, but I had to go to the doctor's office and sign some paperwork that pretty much gave the doctor's office permission to review my case with the state. So we will see what comes of that. It'd be nice if the state can get involved and force the insurance companies to cover this plan, or I don't know what else it would be. What does anybody else have any experience with this, of having your insurance denied a medical plan and having your doctor take your case up to the state for review? If you did, leave some comments on there. Let me know what your story is and how what happened with it and whatnot. So I'm kind of curious to see what they're trying to accomplish. I should have just asked the nurse when she called me up and talked about it and asked me to come in to sign some paperwork, but I didn't think about that at that time. It's like, oh, okay, great, without even thinking why. Excuse me. Why that they're doing it? So I should have asked. I guess I could always call them back and ask, no, what's the goal of reviewing my case with the state? But you know what? I'm just gonna let them do it, and we'll see what comes of it. So that's the update on my myasthenia gravis. Of course, I had a discussion yesterday or last night's video. If you don't want to watch that, is I went on anesthesia. I had no issues. I didn't have a myasthenic crisis caused by the anesthesia. Thank God. But like they said, it was a light sedation. It was just a drug-induced sleep endoscopy. So they were just checking the way that my airway gets blocked when I sleep for my sleep apnea to see if I qualify for the Inspire device. So I didn't have any crisis off of the anesthesia. But they said no, if I do decide to move forward with getting that implanted device for my sleep apnea, that is definitely a stronger sedation and of course a longer procedure. So yeah, that'll be that will have more danger with it. Just going or just doing it in general for a healthy person can have complications. But so yeah, we'll see what I think I'm leaning towards having that device implanted so I can get rid of my CPAP machine. God, I hate that CPAP machine with a passion. But anyway, all right. So let's go ahead and I'm going to check, see where my blood sugar is at today. Got my stuff here, especially since I didn't have my Mounjaro shot last week. So with my alcohol wipey pad. Let's what finger to pick on today. We'll do my pinky today. I think I did my pinky last Saturday too, but oh well. Alright, get some blood flow into it. Go at the fun part. Hate that. And we got some nice little blood spot. Stick in my test strip. Should suck that in before I poke it. Here we go. Alright, I'm fasting because I just woke up and I just showered. Went up 104. Still not bad for being a diabetic. And I got to remember that I didn't do my Mounjaro. I didn't do my Mounjaro shot last week, so it's to be expected that the blood sugar level's gone up. So, but again, so my blood sugar is 104 this week. It was 98 last week, 96 the week before, and 93 the week before that. So it is steadily going up each week since I've started the steroid, which I was warned that would cause my blood sugar levels to go up. Thankfully, it's not going up drastically, but it is going up. But like I said, I didn't have my Mounjaro, so the increase for this week probably is just because of that. It's because of not having my Mounjaro shot last week. So, but anyway, before I take it this week, because I get to go back on it now since that's over. I had anesthesia yesterday, so my weight for this week. Last week I weighed in at 234, which was a 1 pound weight gain. And that's made, I had gained 3 pounds the week before that, since I started taking the steroid. So this morning, I weighed in at 235. So I gained another pound. So for the 3 weeks since I started the steroid, I've gained 5 pounds. And I'm on a low dose steroid. I'm on the low dose of prednisone. Just 5 milligrams. Doctor doesn't want me to go up on it anymore because my symptoms are still elevated. They haven't leveled off or decreased like they should. He said the elevated symptoms should stop after a week or two, and then within a month I should see improvement. But I guess I should be thankful that my symptoms didn't get worse, except for the fact maybe you can say they have now, because I'm having more trouble talking at times. Get mucusy. Sometimes when like on this video, I've had to stop a few times. It's not because I was struggling to get the words out with my tongue. I'm not having any sensation in my tongue right now, which is making me have trouble talking at the moment. The more I talk, the more chance it'll happen. But it was more I get mucus built up in the back of my throat, and I have to clear it out first before I can continue to talk. So uh, that's I was reading up on it, and that is part of it. Could be another part of me leading up to a crisis. So I hope not, but you know, we'll play it by ear. Hopefully, I don't ever have a crisis. But if I ever did have a myasthenic crisis and I end up on a ventilator for any amount of time, that's an automatic qualification for disability. So I don't want disability, but you know, if I have to, I have to. So, but anyway, so that puts me at a 235. So that's a 5 pound gain since I started steroid, and for 29 weeks of being on Mounjaro, that's the Mounjaro last week's shot. I'm just a pound lost now because I started this journey back on Mounjaro 29 weeks ago when I was able to go back to it from Ozempic, and I've only lost 1 pound. But they said it's controlling the blood sugar. That's the main job of Mounjaro, is controlling the blood sugar. The weight loss, it would have been better, but like I said, I've been dealing with. I started to deal with symptoms of the myasthenia gravis soon after going back on Mounjaro. So, but I did have some. I had lost 11 pounds early on in being back on Mounjaro. But like I said, after a few months of being back on Mounjaro and having success on the weight scale on top of it, is when my symptoms started to occur, and then I was officially diagnosed with generalized myasthenia gravis in July. So I've gained 10 pounds back since my initial symptoms started. So yeah, that is what it is. Main thing is though to make sure that my blood sugar stays under control with Mounjaro. So all right, let's go ahead and do my shot. Again, I'm on 5 mg dose. Take the cap off. You'll see the needle on the inside. Move it to the unlocked position, and you want to stick it in the fat part of your arm, or in the fat part of your inner thigh, or on your gut. Or you have to be at least 2 inches away from your belly button. So I have no idea what side I stuck it on last week. So I'm just gonna do. Let's do this side. All right, at least 2 inches away from belly button. That's about right there. Looks good. You push in the button, you'll hear a click, and you'll see the needle go in. And then a second click, you'll see the needle retract. So here we go. Voila. Second click, and you feel the needle go in and out. It's all done. No blood spot this time. No little droplets of medicine. And voila. That's simple, folks. Alright, I don't know if I have anything else for you this week. Hopefully I'll get my blood sugar back under the 100s next week, now that I was able to take my shot of Mounjaro. And I don't know how soon I'll hear from the neurologist about what the state decided. I'm sure it's not quick. I'm sure it's going to be weeks, if not months. So by then the insurance might cover, because by then they want, I think, 3 months on a steady dose of a steroid, and show that it's not doing anything with it, it's not improving it, then they would probably cover the nuclear treatment plan. So, but we'll see. All right, that's all I got for you, folks. If you happen to like this video, like what you see, find it interesting, go ahead and hit the like button. And if you want to be notified for when I post my next videos, I do at least one video a week, if not more, depending on what's going on. Go ahead and hit the subscribe button, and you'll be notified of future videos. If you like cruising videos, I have another channel called Cruise with Sean that has videos of my cruising. I got a Halloween cruise coming up in a few weeks where I'm on the Norwegian Jade out of Miami, Florida for a 7-day cruise, and that's a $100,000 slot tournament finale cruise. So I'm looking forward to that. I've never been on a cruise ship during a holiday. I love Halloween, so I bought my decorations for my cruise cabin door. My magnetic Halloween decorations for my cruise. So can't wait. Hopefully I'll get some good videos off of that. Hopefully they have the ship decked out in nice Halloween decorations. So all right, that's all I got for you. Have a great weekend. Remember to enjoy life. You don't know. You don't know what life will throw at you. You don't know what life's going to throw at you. So, all right, I'm going to end it there. All right, have a good one, folks. Bye bye.